the healthcare delivery chain. What are those areas, key areas of opportunity to capitalize on within this value chain development? Now, we are looking at this from the perspective that Mrs. Laoye, also one of the panelists, has mentioned that generic drugs has had great impact in reducing the cost of providing care, as well as being able to also provide drugs where necessary at a much cheaper cost. So if you're looking at that context as a key capability, the ability to reduce costs particularly and still be able to provide drugs who can perform perhaps exactly what we're looking for. How would you also identify what those key areas are for opportunities for capitalizing on in this value chain process?
I think there's great opportunity in three areas that might improve access. I think we might all agree that primary care is a big one to look at right now. All we have to notice is that by the time we go to the general hospitals or any of the tertiary centers, we notice an influx of a lot of people there that can necessarily be handled by a buffer zone, which is a primary healthcare center or a psychiatric healthcare center. I think there's also a lack of a walk-in clinic culture in Nigeria. We either go to the pharmacist or we go to a hospital, so it's either we're curing ourselves or we're dying. There's no in between. There's no factor whereby I'm going to a hospital or a physician or a care provider to get better or to look forward towards something. I think in terms of supply chain, there's a lot to do there. Supply chain has been one of the key factors in why hospitals find it so challenging to not transfer the cost of drugs down to the patient. So we at Drugstock are trying to figure that out. It's not been easy because you realize that the problem is inherent, the fragmentation is inherent to the system itself. So in terms of value added, I'd say supply chain is a big sector in the next 10 years for healthcare to improve efficiency by. The third thing I'd like to point out is proactive healthcare. So some people might talk about it in terms of preventative health. Some people talk about it in terms of the area of nutraceuticals. So how do you ensure that people get healthier rather than wait for them to walk into your doors? So from that angle, I think Nigeria has been experiencing a great growth in these three segments. I think we might all agree here that primary care is the next big wave of healthcare reform in Nigeria. And in terms of supply chain and drug distribution and generics and their impact, we're trying to play a very small role in that, but I think everybody else in this room has a bigger role to play as well.
I would like you to tell us what you expect from PharmAccess in the next 5 years. What do you expect from them in terms of partnerships, in terms of direction, in terms of support? What are those things that you expect from them? One, what are your own main goals within the next 5 years? And how do you just see quality developing in Nigeria and this issue of access and innovations? Do you see a trend that is going in the right direction? Do you think we missed it somewhere along the way? Just round up and give us your take on those issues.
And I think if we're going to make progress in the next couple of years, is to make sure that national policies or state policies actually domesticated at the local government. So there's certain policies that are out there, electronic, national health management information systems and all that. But I go to the local government officer who supervises my clinic, she tells me I cannot submit data electronically. So how do I deal with that? There's a national policy on tax shift, and the same local government officer comes to my clinic and she says a nurse can't do this or a doctor can't do this. So maybe what I would like pharmacists to do, and I'm not quite sure it's even the work of pharmacists, I think it's for all of us. While I agree with Olumide, we should go to Abuja. I think even if we have agreement or consensus with the guys at Abuja, if the guys at the local government level don't understand, or first of all are not aware of the policies that are out there, they don't understand the implication of those policies, or in some instances they are not motivated to actually commit to following those policies, we're not going to make any progress. So it's to ensure that regulation exists, but that the people that actually are the foot soldiers, that I call them, are aware of the regulation, believe in that regulation, and I'm motivated to abide by that information. Because guess what? I sent my records. I sent my records hard copy to that lady, and the guys in the States say we don't see your records. But I'm willing to send it electronically, and she says no, that government doesn't allow that. But the state coordinator has said I can send my records electronically. There's a national policy on that. So for me, it's to make sure that we figure out how to sort out this mismatch between the expectations of that representative of the same state government that supervises my clinics and what the state or the national policies that actually exist as documented are.
For me, I want to thank PharmAccess for the bold steps they're taking to improve quality in our environment. I also want to thank the Hygiene group for allowing my facility to be involved in this low health insurance scheme in my community. Like I told them in Para Hotel when we met, I said, you're coming to my place, it's just a signage of purpose. You are interested in taking care of the poor. I'm interested in taking care of the poor. That's why I started my clinic in a rural environment. So, what is the way forward? Don't get tired. For me, I don't get tired. Don't get discouraged. Along the line, something will give one day, and the right people will come in. Even in the developed economies, they still have their challenges. There are, I think, about 48 million people not registered by any health insurance scheme in America, not until Obama came. So we should believe that in the end, good things will come. So we shouldn't get discouraged. And for my colleagues, please, nobody can pay you for whatever you're doing. I keep saying it, nobody can pay a doctor for whatever he does. I don't think there's any right amount. Anybody can be paid for saving a life. So, let's look at those people who are disadvantaged and see what we can do to help them. So, the number of strikes you go on per year, we should reduce them. It's true. You can imagine you have a field, you planted some yams. Tomorrow you say, oh, I'm annoyed with my wife, I'm annoyed with my, you don't go to your farm. In the end, you are going to harvest what? You are harvesting weeds. And what do I mean by harvesting weeds? In your case, you'll be paid, but the money you are paid, you didn't earn it. So, and there's a punishment for it, so thank you very much.
Thank you. Maybe with PharmAccess in mind, I think for me it's twofold. I think having had PharmAccess as a partner at Hygiene over the last sort of 15 years has been one where we have continuously pushed the boundaries. You know, we've continuously sort of, as I said earlier, disrupted. We've thought about things that need to be done, and even though to start with they seem impossible, we've sort of chipped away at it until we've gotten to implementation. And I think I see two key areas that have come out of that. One is PharmAccess's voice, you know, in the advocacy, particularly here in Nigeria, which has become a much stronger voice in what we discussed earlier, universal health coverage. And in really sort of taking now the, shall I say, the results of what I will call the pilot work that's been done, and really being